Scott, it's good to see you. You probably knew all this already. Did you know about the whole Rick Bright and BARDA saga? And that was, did you realize it was about Molnupiravir? That was the drug that they were talking about, which Senator Elizabeth Warren came out and said, we're trying to hype this drug and we shouldn't be doing this. And it actually delayed it. We would have had this a lot sooner if it wasn't for all this political crap that was going on.
Well, this story's been out there. It was in the whistleblower complaint that Rick Bright filed, that initially he had some reservations about the drug and about adding more funding to the drug because the government had funded this very early on. I'm not sure that it had a big impact on the ability to take this drug forward. So, Merck and I think Ridgeback were committed to this regardless of what the government did here. The only lament is that we didn't have more investment early on in trying to scale up the manufacturing of the drug, so we're going to have a limited supply if this does come to the market before the end of the year.
Well, it doesn't look like there was any merit to the accusation that there was some type of, I don't know, financial incentive to let Mr. Painter develop this. I don't know. It's all in the Wall Street Journal. It doesn't smell great to me, Scott. And as the Journal points out, what if we had this a year ago, 6 months ago? How many? Do the 50%. Do the math.
Yeah, look, it's hard for me to decouple what impact the government issues here that you're talking about had on this. I know the people behind this on the Ridgeback side. They were committed to this very early on, and I know the people at Merck were committed to this. Again, I think where the government misstepped is that we didn't invest enough in trying to scale up the manufacturing of therapeutics across the board. It's not just this drug. It's also the antibody drugs. I mean, when people talk about Operation Warp Speed being this success, they also need to look at what we don't have. We don't have adequate supply of the monoclonal antibodies or these therapeutics. There was a focus on the vaccines, and there wasn't enough focus on the therapeutics and trying to get the available manufacturing. That's where the government really could have played a role. The companies can develop these drugs on their own and do the clinical trials on their own. They're good at that. Merck knows how to conduct a massive clinical trial. I think where the government could have done much more was scaling up manufacturing so we'd have excess capacity if one of these drugs was successful. That's the problem.
It's just part of the same phenomenon where the vice president at that point said I wouldn't take a vaccine developed by this administration. I don't know. It just reads like the same stuff to me. If anybody's interested in the Wall Street Journal on the op-ed pages by one of their op-ed writers. Okay, Scott, so how quickly do we see these actually where you can actually have your doctor can prescribe this for people?
Yeah, look, it's really hard to say. The FDA has been reviewing this data on a rolling basis, so they've seen a lot of the preclinical and clinical data, for that matter, even before the EUA has been filed. I'm quite certain. I would suspect that this is going to be perhaps a 2-month review. I don't think it's going to be quite as fast as we've seen some of these vaccine authorizations. And so figuring that it takes a CDER about 2 months to get to an emergency use authorization, which I think is an optimistic scenario, you could potentially have this on the market before the end of the year. Merck does have the available supply. They're going to be ready to ship it as soon as it gets authorized, almost immediately. They're starting to package it. They just need to get the labeling on. That could take about 2 weeks from the time of authorization. So this could be available before the end of the year if FDA moves quickly.
Now, what do you make of the latest Fauci comments about Halloween? So now Halloween's okay. Christmas was, I don't know, Christmas. But now, getting candy from strangers is okay because I think he noted that you were seeing a decline of Delta in certain areas. Where are we? Snapshot today, Doctor?
Well, look, prevalence has collapsed in the South. Delta's run its course down there. The national averages are being driven by the sharp declines in big states like Florida and Texas. The plains are heating up. Prevalence is 70, 80 cases per day in the Midwest and the West. So there are parts of the country right now that are pretty hot. We're still not seeing a big resurgence of infection here in the Northeast. New England and the northern states, we are seeing cases start to tick up. I think as the weather gets cold and people move indoors into confined spaces without masks, you're going to have risk and you're going to see cases pick up. In the Northeast, we're still not seeing that happening. We may be somewhat impervious to a big wave of infection because of the high vaccination rates and a lot of prior infection here. But I just think you need to judge your local prevalence and judge your vaccine status. A lot of kids right now are going to be vaccinated ahead of Halloween, and so that's going to afford them a measure of protection. I still think you could do things that you want to do. You just have to be more careful about how you approach them.
Shepard Smith here. Thanks for watching CNBC on YouTube.